Group guidelines. I think to repeat this as well again, but please, lively, respectful discussion, create an inclusive space, welcoming for everyone, and confidentiality is really important. So there are things that you're in this webinar. Please ensure that you're keeping those experiences, you know, confidential, where you obviously don't have the right to share that outside of this, and provide content warnings where appropriate if you are, for example, going to share your story, and also just consider your language choices. Again, something that the TGG program is very keen on. We have a lot of resources around this. We've spoken around the power of language. We have quite a lot of resources that you can use to speak to how we want people to speak about FGM with sensitivity, but also just making sure that we frame it as it should be, as a violence, as a human rights violence against women and girls. And without further ado, I think we are ready to start the webinar. And we start off by introducing, and I must say I'm really honored to introduce our keynote speaker. Natalie, let's move on to the next slide. Our keynote speaker, who is Loveness Nzuru. I know we practice this, so Loveness, I hope I haven't butchered your surname. But like I said, it is such an honor to introduce Loveness. She has been in the space of advocacy for a very long time, from a very young age. I will let her tell you that if she wants to. But Loveness is currently the Programs Associate Consultant at Rosario Memorial Trust, and she leads the organization's strategic programming on research advocacy, girls empowerment, with a strong emphasis on inclusion, community-driven approaches. She's also the visionary of a survivor-led initiative, Passionate Circles, which supports children education assistance, a creative book club, and community leaders' peer-to-peer guidance. At Rosario, she is responsible for designing and facilitating intergenerational advocacy initiatives, supporting young people, especially in rural communities and marginalized backgrounds, to engage meaningfully in national and continental policy processes. She plays a key role in ensuring, under the Rosario Memorial Trust's work, that there is engagement with the African Union Convention on Ending Violence Against Women and Girls, ensuring that girls and women are actively contributing to the shaping of regional commitments and framework. But what excites me most about Loveness and her work is before she took on her current role, she contributed to two notable laws in Zimbabwe, with one of them being a lead applicant in the landmark Mzuru versus Ministry of Justice and Other case at the Constitutional Court of Zimbabwe, which led to the outlawing of child marriage. And her advocacy and policy work has influenced and continues to influence legal and systematic change both nationally and across the region. Loveness, the floor is yours. We're really, really excited to have you speak to us and hear what you have to say around youth advocacy. Welcome, Loveness.
Thank you, Kirigo. I'm really in tears just hearing my own bio, and whilst you're hearing it, you are reading it or talking about it. I'm really honored. Thank you so much. Good morning to everyone, and I'm sure that there are others that are now in the afternoon. So good morning and greetings to everyone joining today. Thank you so much for having me as the keynote speaker. It is really an honor to be part of this launch of the Youth Advocacy Activism Toolkit to End FGM. To me, it means a lot, and it meant to end all violence against girls and women. Congratulations on this toolkit. I'm very more humbled to have my story and journey featured and included in the advocacy, rather my advocacy journey included as a case study in that toolkit as well. So watch out for the 5 case study that was mentioned in that toolkit. This toolkit is more than a document. It is a powerful statement that young people in Africa are not just the future, but we are the present and the present force of change. So congratulations to you, young people. You are the force of change. I stand here not as a programs consultant, or a member of the Global Survivors Council, or the big bio that Kiriko has just mentioned, but as a survivor of violence myself, someone whose life could have been silenced, but instead became a voice to fight for the rights of girls and young women. The power of youth advocacy lies in the fact that we do not wait for permission to speak truth to power, but we as the young people bring agency, we bring the creativity and a lived understanding of the realities we are trying to change. When I began my journey, it was not because I had resources or influence. It was because I knew my silence would not only enable a cycle of violence to continue to my children. I have two children, by the way, or to my sister, or to my sisters, mine or yours, or the next generation. Youth advocacy, especially when survivor centered, shifts the narrative from statistics to real lives, from abstract problems to practical solutions. Therefore, we are not just telling stories, we are demanding accountability. Today, when you share your story, remember that we are demanding accountability. We are mobilizing communities and we are pushing governments or influencers to transform commitments into concrete actions. And this happens when people listen and listen intentionally. When survivors and young people lead, change is authentic, sustainable, and inclusive. Policies written without our voices, and I should emphasize, without our voices, risk missing the realities on the ground. But when youth and survivors are part of the process, solutions reflect lived experiences and directly respond to the gaps that laws and systems often overlook. I have seen the power of survivor advocacy firsthand. Kirigo has mentioned the two laws that I mentioned to appeal for. When I, together with another survivor, appealed for the ban of child marriage, debates about the new law were happening everywhere, including even on the buses. People would question why it was necessary to say no to child under 18 to be married. And in these moments, I would share my story. I would speak openly, and the whole bus would just fall silent, listen, reflecting, beginning to understand why this law really mattered. Survivor advocacy is not just about conferences. It's not about courts or being loud or being disrespectful, but it's about shifting mindsets in ordinary conversations. It moves policy forward, but it also changes hearts and minds in everyday spaces where culture and norms live. Youth advocacy is not a side activity. It is central to the movement to end violence against girls and young women. Why? Because violence thrives in silence. Violence thrives in silence. And young people are refusing to be silent because harmful norms are deeply generational, and it is the youth voices that challenge and reshape them. We have a lot to do, young people, because accountability requires persistence, and young people are persistent, that we know. Across Africa, we have seen young advocates challenge discriminatory laws, demand access to education, organize community dialogues, and even shape global policies. With tools like this toolkit, the potential is even greater, and I'm really excited about it. It gives us not only inspiration, but also the practical guidance to organize, to mobilize, and I have mentioned this, to influence change at every level, from the villages, from your home to the parliaments, from schools to continental platforms. As we launch this toolkit, my call to governments, if they are available, if or ever we are going to share this meeting to them, and policymakers, let this be intentional, that youth advocacy participation is not tokenistic. Recognize youth and survivor advocates as equal partners in shaping the Africa we want. Kirigo and everyone else, I'm sharing this and I'm giving this to you so that you can share with those governments and policymakers. To my fellow young advocates attending today, and those that you are representing, and those that you have in your WhatsApp messages or WhatsApp and social media, use this toolkit boldly, not as a guide, but as a reminder that your voice is power, your story is valid, and your leadership is essential. Together, we can transform promises into progress, and we can end the violence that has denied too many of our sisters and aunties their childhood, their dignity, and their futures. This toolkit shows that we are no longer asking if young people should lead. We are showing how we are already leading. Let us keep pushing, let us keep challenging, and keep building a continent where girls and young women live free from all those forms of violence. Thank you, and over to you, Kirigo.
Thank you so much, Loveness, for sharing your time and those encouraging words. And you are right, the young people in this room, because most of the people that have joined this room are already in this journey, and it's just encouraging us to continue, and where we need to learn, continue learning. So Loveness will not be with us all through, but she will stay until she can. So if you have a question, please pop it in the chat, and we'll be sure to send it over to her. Loveness, if you're happy for people to reach out, have a chat, please drop your email in the chat. And again, thank you so much for honoring us with your presence and your encouraging words. And as we move on, allow me to introduce, before we move on, allow me to go through a little bit about what the TGG young people have been able to do. Now that Loveness has sort of set the scene for us in terms of what our role is as young advocates. I say our, as if I'm part of youth, but hey, I could be young at heart. But what the young people at the TGG program have been able to do. So Natalie, next slide, please. So these are just a couple of highlights around some of the work that the young people have been able to do over the last couple of years that we've been running the TGG program. And let us start off with August 2022, where we brought young people together and they actually curated a forum. We sent out questionnaires and surveys and asked, what do you really want to talk about? What is it that you want to share and engage in and learn around the work that you've been doing or that you may want to do around FGM and the wider, as we say, the wider gender-based violence, gender equality conversation. And from the forum, what came out was a call to action. And in that call to action, the youth identified certain things that were very important to them. And these are the things that we've been building on over the last couple of years. So from 2022 to now. And some of those things, just to highlight a few, was that youth engagement in local, regional, international decision making, something that our keynote speakers already spoke to.
De
That we need to be in
decisión
those
que va a
spaces
ser
so that
ignorante a un nivel
the
regional
policies are
internacional.
responding to the things that we experience as young people in our local communities, and also to that we can influence and respond to gaps that we are seeing in the work that we are doing. But also they wanted to really speak to community awareness and community-led activism and ensure that the work that is being done is being led by communities. The issues that we face, all social issues, come from a context, and it is very important to ensure that the solutions that we're giving are very contextual. But also, they were very keen on speaking to policy and legislation and how young people can be involved in that policy making process at whatever level it is, and what knowledge they need to be able to do that effectively. But something else that was crucial for them was evidence-based research and knowledge that helps them create programs and advocacy initiatives that are effective. And one thing that was curious for me is that they really wanted to understand how you do research from a local perspective. Like, how do you start research wherever you are that helps you to improve and influence and inform your advocacy and your programming? And this has always been something that even as a TGG program we're very keen on, is around well-being and safety and mental health, even as you do this work, which I mentioned. And I think we all know is quite heavy in whatever aspect you're doing, whether it's FGM, whether it's child marriage, whether it's sexual reproductive health and rights, and all of these things are interconnected. How do we ensure that we have the support that we need to be able to do this work properly? Then moving on, went to June 2013, and we had young people involved in the Women Deliver Conference and majorly around the Kigali Declaration, which came up as a product of a collective of different organizations through the global platform for action to end FGM. And the young people were very crucial in ensuring that we had sessions that were responding to some of the things that they had identified around grassroots organization, around laws and policies, again, around harnessing their power as young people in this movement to end FGM, again around evidence research and data, and also around addressing emerging trends. And those were sort of what were the five themes that we would say of the Kigali Declaration. And we shall put that in the chat for you to have a look at, and also the call to action. So you can go away as well and just be able to look at those as you think around the work that you do. Come October 2023, we had the Africa Union FGM conference. At that point, Orchid Project and a couple of organizations from the African continent had this idea of, we have the AU network, for example, on ending FGM. We have the US network on ending FGM. We have the Asia network on ending FGM. Why don't we have an African network? And this was really for them to come together again to share knowledge and learn and represent the African continent in terms of what are we asking for as a movement to end FGM. And young people have been part of that process. At the moment, one of them is actually co-hosting the African network. And they're working, it's very relatively new, but they're working together to put together the youth arm of the network. More details to follow. If you want to know, please reach out to us. Come April 24 ECOSOC Youth Forum, young people were facilitated to attend the ECOSOC Youth Forum. And what was the main aim of this? We were starting to have conversations around the Pact of the Future, what is essentially supposed to take over after SDGs, the Sustainable Development Goals. And the aim there was to make sure that FGM does not get lost. We have FGM, we have SDG 5.3, which is very specific around FGM and child marriage. And we wanted to make sure that FGM still remains a priority issue. It's already underfunded as it is. As is the gender equality space, but we wanted to make sure that it doesn't get lost in all the conversations. And therefore, we had young people speaking in these different forums around the importance of ensuring that FGM is prioritized and also looking at it as an intersecting issue. Again, FGM is not a standalone issue. It has connotations to health, it has connotations to education, it has connotation to sexual reproductive health and rights. So all of these things needed to be spoken to so that FGM doesn't sort of get lost in these bigger conversations around global governance and sharing of monies and all of that. And we were successful enough in having those conversations and having young people represent and speak to that. Following up again in May 2024, we then had the UN Civil Society Conference, which was a follow-up as the Pact of Future conversations continued. Again, we had young people there doing direct lobbying and influencing, again, ensuring that FGM remains a priority issue at a global level, and also speaking to what we all talk to as young people, inclusive youth leadership that is made a reality at all levels, and also resourcing, especially for grassroots and youth-led movements. And their lobbying and their advocacy sort of was successful because we saw the inclusion of both the issue on FGM and also on youth leadership in the final draft of the pact. And that brought us down to October 2024, at the UN General Assembly 79th session. And this was where the final pact was being signed, discussed and signed. And we were again able to facilitate a couple of young people to attend, and we kept the FGM issue within the pact, in the final draft of the pact. If you haven't seen the pact, please go into the UN website. You should be able to find it. If I have it somewhere, I will put it in the chat. And it's under Action 35 around promoting and respecting of human rights for all young people and fostering social inclusion and integration under Section 61E, which specifically, explicitly speaks to harmful practices, which include female genital mutilation and child early and forced marriages, among other harmful practices. And then between October and December 2024, the young people that will be speaking to us and a couple more came together and started developing the Youth Advocacy Toolkit. And this is what we are discussing today, and are really excited that we have a final product that young people can use as a guide. But young people have also been participating in the Commission on the Status of Women from 2023 to 2025, sort of sitting in various panels, sharing their knowledge, their learning, successes, and the challenges that they've been facing as they continue their advocacy work, and also the vision on the different issues that they see as they continue addressing FGM at all levels. And this could be around sustainable resourcing, from program initiative, from the importance of having a girl-centered approach, which is something that the TGG program is very keen on, that we need to have girls at the center of the programs that we are, because they're ones who are affected by FGM, and so their voices need to be heard just as much as our young voices, as our young adults' voices need to be heard. Again, all these resources are available on the TGG website. We'll have a link for you in the chat. Please go have a look at those. A lot of learnings, a lot of guides on what to do within communities, engage with community leaders. We have a work around survivors and how you engage with survivors. So please log on to the TGG website and scroll through and see what is helpful as you continue your advocacy programmatic work around FGM. And as recently as June 2025, we have the East Africa Community FGM bill that has been reintroduced, draft bill, which is meant to cover the East Africa countries. And we have young people engaging with the East African Legislative Assembly members to really speak to what they think should be in that bill and giving their recommendations. The bill is due to go to public participation very soon, and it is very key for young people's voices to be heard in that process. And so young people are speaking to things around ensuring that provision of services for those at risk and survivors of FGM is included, ensuring that governments who are the duty bearers are ensuring that there is resources to continue initiatives for ending FGM, and also having youth involvement around the policy aspect and around other initiatives in country and regionally around ending or addressing FGM. So those are just a few highlights of what they've been doing. And for those of us who are from any of the East African countries, this conversation continues. I know we have a couple of our young people that have joined us today. They'll be having a webinar on Friday to discuss the bill. So keep a lookout for that. And if you really want to join them, please drop an email and I will send you the details. And that really is a quick roundup of what the young people under the TGG program has been doing around their advocacy. So before we log off, or rather I log off for a couple of minutes, let me introduce Katie, who will take us through the next session, really just looking at what the toolkit has. And Katie and Natalie, I don't know if Natalie has joined us today, it would have been great to have her, are the ones that facilitated and guided the young people in putting this together. We needed as many heads to come together to structure this. And so Katie, please take the floor.
Thanks so much, Kiriko. And hi, everybody. It's always such a privilege to be in this space. Natalie, if I could ask you to move on to the next slide. And Natalie is here, Natalie Roby-Tingo, who, yes, was the co-facilitator of this with me. So maybe I'll just ask her to put herself on camera and give us a wave if she's able to. But yeah, I'm just going to take a few minutes to walk us through the toolkit and what's in there and the process of creating it. But I'm going to try not to take too long because I know that what we really want to get to is the panel and hearing from many of the youth advocates that Kiriko, you've just given us a brilliant rundown of how busy everybody's been for the last few years. And of course, I had goosebumps actually when Loveness was talking earlier about the power of youth advocacy and centering survivors and survivors' stories. So that's where we really want to get to. But let me just give you a quick breakdown. As people have already very clearly and powerfully summarized about, why this toolkit, why is this here? We know, and I know that I'm speaking to people on this webinar that are very much know this already, but we know that ending FGM is urgent. And there's a fantastic policy brief that's come out from Orchid Project and the University of Birmingham. If you haven't seen it, I'd recommend checking it out. But they've produced some very powerful statistics about why this is so urgent. So we know that it's one form of violence against girls and women. And I think it's fantastic fantastic that we're now talking about the intersections of violence and how all of these, how these different movements come together. But this particular form of violence is affecting 4.3 million girls who are at risk of the practice every year, that there are 230 million survivors globally, and that there are 44,320 deaths annually due to FGM. So we know that this is urgent, and that we've got to keep it at the top of the global agenda. And Kirigo has just taken us through many of the ways that that TGG and the Orchid Project and all of the youth advocates that they're working with are doing that. And we also know, again, as Kirigo and Loveness have already mentioned, that this practice primarily impacts girls and young women, and that those who are impacted by the practice have to be at the centre of the movement to end it. That's where change is going to come from. And that we also know that advocacy is a really powerful way to change how power and resources are used and distributed, and that when we do it right, when we do it in a powerful way, it can open up these new spaces for dialogue and for change, and that can happen at a very local level, with local councils, with local schools, and it can also happen in global policy spaces. And as Loveness spoke to us about earlier, like the power of stories being so central to that, and that youth advocacy is really not a side activity. So that's why the Youth Advocacy Toolkit came together. And I'll ask us to move on to the next slide. So how it came together, it was, as Kirigo's already talked to us about, it was a collaborative process. And you can see from what she shared that collaborative process has been an ongoing thing, going back a few years now, and maybe starting with that online youth forum that brought together this call to action that was co-developed by a number of youth advocates. And we actually used that call to action as sort of the starting point, really, for thinking about this toolkit and what needed to be in it. So there was a series of workshops and on sort of youth advocacy, some of the strategies, some of the ideas we might think about. And then there was a collaborative process of designing the toolkit and thinking about what needed to be in it. What do we want to prioritize? And then myself and Natalie, my co-author, then took those ideas and went through the writing process of the toolkit, which also went back and forwards with a number of people who'd been involved in designing it. So that was the process. And then also what I wanted to highlight was how central youth advocate stories are to the toolkit. And we're going to hear from a number of them today already. And there's another slide telling you what those case studies are. But what we really tried to do is make sure that, as well as talking about, theory and strategy, we were really illustrating that with practice. Like, how is this actually working? How can we use some of this, and what have people used already to really create change in a meaningful way? So in section 1, we talk about why youth advocacy. Where are we now? And actually, I think since we wrote the toolkit, there's probably more to update there from what Kirigo just spoke about. In section 2, we're talking about key steps to developing an advocacy plan. And in section 3, we're talking about some of the different tactics and strategies for influencing. So on the next slide, we just give you a brief overview of what's in section 2. So these are the key steps that we identified. Now, they're probably not going to be too much of a surprise to people. Anyone who is engaged in advocacy work, these are probably something that you do intuitively anyway. But I think it's useful to have these set out and think about, well, how, if we're planning for the next year, if we're planning for the next 5 years, what are some of these steps that we know we need to work through? So we talk about identifying the problem and the gap, like where is it? What action is not being taken? What are we not doing? And what are some of those potential solutions that we we see. And here we really talk as well about the power of evidence, and why it's so important to be informed, to have an evidence base, or to grow the evidence base, so that we can point out more powerfully what that problem and that gap is. In step 2, we talk about identifying those key advocacy targets, and then thinking about and how might we approach them, and how might we think about who are our primary targets, who might we also want to reach, but they're not the focus of our advocacy. And then in step 3, thinking about, well, how and what are some of those key messages that we want to reach them with, and how can we make those as succinct and as powerful as possible, and again really grounded in that evidence base. And then in step 4, thinking about, and what are those tactics we're going to use to reach them with those key messages, which brings us on to section 3. Where now we're absolutely not saying that these are the only advocacy tactics available or the only strategies available, but when we went through the consultation process, these were the ones that kind of came to the top that people wanted to go into a bit more detail about in the toolkit. So we identified these 5 different tactics or strategies. The first one, using evidence and stories. The second, mobilizing communities. The third, how we actually grow the movement, and think about that, the intersectionality of the movement, and how we have more power together. In tactic 4, we're thinking about positive mental health and supporting people's well-being, and that's definitely been referenced today already. But how central that is actually to maintaining a strong and healthy movement. And why that's so important to being able to create the change that we want to see. And then finally, in the 5th tactic, thinking about how we engage with those different regional and global policy events.
Is it me or have we lost Katie?
I can't hear Katie at the moment, Krigo.
Right, yeah, I think we've lost Katie. Sorry about that. I'm sure it's internet issues. Oh yes, everyone's lost the speaker. As we wait for Katie to get back in, maybe I can just pick up from where she left. Hopefully she'll be back in with us. So as she was talking to us, she was going on to what strategies and actions and priorities the young people pointed out as being most important to them in terms of how they approach their advocacy and what would help them to get to whatever advocacy objective or goal that they had. And I think she mentioned this, evidence and stories was key, and really thinking around how you collect your stories, given that FGM is a sensitive topic, and what you need to put in place around safeguarding and also around consent. Mobilizing communities was huge in the sense that, as we all know, FGM starts from a context. And even within that context, there's different contexts within sort of families and sections of communities, and really how you mobilize communities around an issue and speak to it from a point of understanding where they're coming from, and also imparting the knowledge that you want to. And what tactics do you use to ensure that you're carrying the community along as you're sharing your message around FGM, GBV, and all those other violations against women, girls. The third one was around growing the movement. And I know the young people that you will be hearing from are part of movements and lead movements, because they want to ensure that they're not just the only ones that are speaking to this, but they're growing the movement of their peers, but also influencing others within their spheres of influence to ensure that they're speaking in one united voice around the issue. And so how do you grow the movement? How do you influence people to join the movement? And how do you ensure that even as you're building the movement, that people feel heard and included in the movement that you're building? Tactic 4 was around a key issue, supporting positive mental well-being and health and well-being across the movement. How do we support each other? This work can be lonely, it can be hard. And how do we ensure that we are either supporting each other from within, but also know of avenues where we can refer people for support? The CGG program is really key on ensuring that we have health, mental health, and well-being across the movement. And you will find resources around. And this has come as a result of sort of the survivor leadership training and initiative that the TGG has. There's resources around how do you ensure that you're guarding yourself as well as others as you do your advocacy work, to ensure that we are all able to carry this work for the long term. Like we're actually healthy enough to be able to do the work ourselves, but also impact and support other people that we work with as we do this work. And then the final tactic was around engaging with regional and global policy events. And this is where we're talking about having our young people within the UN system, having our young people within the AU system, the East Africa community system, regional and global policy events that really is about speaking to the decision makers, the policy makers that really and truly, as much as we may not feel it at our local levels, have influence in how our issue is looked at, how our issue is funded and resourced. And that is really, really important to ensure that we continue to have sustainable change around our work in addressing an end to FGMC. And next slide, please, Natalie.
Here we go. Just letting you know that I'm.
Oh, you're back. Oh, sorry, Katie. Should have told me.
No. I'm so sorry. My computer, did a really inconvenient kicking me off right in the middle of me speaking. So apologies and thanks for picking it up.
Please go ahead, Katie.
Well, I won't spend long on this slide anyway, but I think this is just to talk about the power of these stories and as I referenced earlier, how important it is that we don't just talk about the tactics and the strategies and the steps, but we really ground this in like, what does this look like in practice? How are people creating this change? Like, and how do we bring that to life? And what we tried to do in the case studies is center the stories of those in the movement to end FGM, but also to learn from broader movements around ending violence. So you'll see that in the first 3 case studies, we hear from youth advocates who are working on ending FGM in their own context. And let me just name everybody as well. So in case study 1, we hear from Kedidiatu Diabate about representing Senegalese young people at the Generation Equality Forum. In case study 2, we hear from Yasir Mohammed on drafting policy on eradicating FGM in Garissa County in Kenya. And in case study 3, we hear from Dr. Costley Aderibige Saba about hearing directly from girls in Nigeria and bringing those voices to Parliament. And then in the final 2 case studies, we hear from the broader movement to end violence against women and girls, learning about their tactics and what has worked for them. And, you know, connecting us in, I think, to that historical, that sense of like how this movement has been growing over many years and how important that feminist activism has been to where we are now. So in case study 4, you hear from Virginia Ndute, who is the CEO of a grassroots organization in Kenya called Women's Empowerment Link. And she talks about how they were engaged in coalition building to pass the Domestic Violence Act in Kenya. And then in case study 5, we hear from Loveness Madzuru, and you have already heard from her today. So you know what an effective and powerful advocate she is. And we hear a bit about her reflections on what was so important in her advocacy on changing national law on ending child marriage in Zimbabwe. So I'll finish there. And I'm going to hand over to Hannah Kamara, who is one of the brilliant youth activists and advocates that is working with Orchid Project and the Girl Generation. And she is going to help us facilitate this next part, where we're going to hear more directly from some of the people whose stories are featured in the toolkit. Over to you, Hannah.
Thank you so much, Katie. Can everybody hear me clearly? If you can, please give me a reaction. Okay, I think everybody can hear me. Thank you so much, Katie. Thank you, Kirigo, and thank you, Loveness, for taking us through this advocacy journey of the Africa-led movement on ending FGM and also what the Orchid Project has been doing so far. It's been such an amazing session. Now we will proceed to our panel. But before our panel discussion, I would really love to say hello to everyone. Salam in Amharic, hello in English, and bonjour in French. Pardon my French, I'm very terrible at that. So good morning, good afternoon, and good evening to everyone joining us from the different parts of the world. I have seen from the chat box that we have participants from Senegal, Uganda, Kenya, South Sudan, Zimbabwe, Somaliland, and more. So it's going to be very exciting. My name is Hannah Kumara. I'm one of the youth advocates for the ALM movement under the Orchid Project, and I'm also a gender safeguarding and inclusion professional. Thank you so much for having me today. I'm very excited because today we will be hearing from very passionate youth advocates and representatives and also experts who are making real changes in their community and beyond. And what makes the session even more special is that our panelists are also members of the Girl Generation ALM movement working group. So we've been together in this journey for years now. This means we will not only hear about their experiences, but also a vision for collective advocacy work. So I encourage everyone who's listening to stay engaged. Please make sure to share your reflections, your comments, your feedback, and questions in the chat box as we go along. I will be monitoring that as well. And at the end of our panel, we will have Q&A session, so you can reflect back on what you have heard. So without further ado, I will go to the first round of questions. The first question is on advocacy examples. So our first question for all of our panelists, this is simple, but it's very powerful. It's about hearing their example of their own advocacy on ending FGM. So, dear panelists, you have 3 minutes each. Our first speaker is Nabila Iqbal from Sri Lanka. Nabila, I will say about Nabila, I will say a little bit about Nabila. Nabila is a Sri Lankan activist for minority and women's rights, focusing on advancing gender justice for Muslim women. She is the founder and co-director of the Sisterhood Initiative, a CSO she launched back in 2020 to foster community advocacy and empowerment. And she's also a Chevening scholar with a master's in human rights from the University of UCL. She was recognized by the Amnesty International as a young human rights defender during the pandemic. I don't know if I've done justice to Nabila's bio because she's such an amazing advocate. Nabila, thank you so much for joining us. I know it's very early in the morning for you. I wish I could send you a virtual coffee. So Nabila, you have the floor to give us your example of your own advocacy or ending FGM. Please take the floor.
Interestingly, when I was born, my mother wanted to name me Hannah, but she didn't. So I think now I know why. It would have confused the panel. Hello, everyone. My name is Nabila, and I want to share a little bit about how I started into FGM. Um, I work with Muslim women in Sri Lanka, and Muslims are a minority in Sri Lanka, and that is a very important context because FGM is mostly practiced by Muslims in Sri Lanka for various cultural and religious reasons due to misinterpretation of the Quranic and Hadith verses, sayings of the Prophet. Um, and initially, when we started on our work, we stayed away from FGM work. I think people at Orchid know at the beginning, I always used to tell them, keep me anonymous, don't get me involved or don't let me show my face in FGM work, just because we didn't want that to have backlash on the work we were doing in minority and women's rights, because we have issues from the government and we also have issues from the misogyny that we face from the community itself that doesn't let us do women's rights work. So it was like that we started this a long time ago. And I remember initially we started having conversations within our organization, our team, and that was when in 2020 I also found out that this is a practice that I have also undergone. And I was about 22 or 23 years at the time, so it was very weird. It was a very weird and awkward feeling to find out much later on. So, but through this work, we've been able to find similar contexts in different countries. And in Sri Lanka, our contexts are very similar to like Singapore, Malaysia, Indonesian kind of contexts, very different from African contexts. So we were able to kind of understand those differences. Um, Now, my friends and my colleagues have done a very serious and in-depth study into how prevalent FGM is in Sri Lanka. It was released this year. Unfortunately, I was not a researcher, but I have assisted them in some of the work. And it shows how prevalent it is and how many different agents we have, from the cutters to the family members to religious leaders who are allowing this practice. So this work I've been able to amplify in global platforms. For example, this year Sri Lanka was reviewed under CEDAW, that's the Convention on the Elimination of Discrimination Against Women and Girls. And I will explain that later. So we've come a long journey with ORCID. Even the Kigali Declaration, I remember the ORCID team asked me to read it out in Kigali. That was to close the funding gap on ending FGM work, FGMC. Um, it's been a long time since then, and I'm really excited to see how far we have come and also how far we can go. Thank you, Hannah.
Thank you so much, Nabila. It was so amazing to see how far you've come. And I feel like you have given all of us the gist of how this FGM issue is not a standalone challenge. It's an interconnected issue of stakeholders' involvement. It's an issue of culture. It's an issue of religion. It's an issue of educating the community. It's an issue of misogyny. So thank you so much for bringing that to our attention, and thank you for showing us what we can do even in times of crisis such as the COVID pandemic. Thank you so much, Nabila. Next, we will be taking a flight to West Africa, and our speaker would be Dr. Cosley. Dr. Cosley is an award-winning global leader with over 13 years of experience advocating against FGM, gender-based violence, and harmful practices affecting women and young girls. She serves as executive secretary of the Global Youth Consortium Against FGM, leading youth advocates from over 60 countries to drive policy change and protect adolescent girls and young women. Dr. Cosley, I know that this does not express you enough. That's why I would love to give you the floor to take us through your journey, this amazing journey that you had on ending FGM and GBV. So, Dr. Cosley, the floor is yours.
Okay, thank you very much, Hannah. I mean, you said everything. There's nothing to add again. And about the flight, that must have been a very early flight because it's like 9:50 something in Nigeria. I'm sure you flew all through the night to get to West Africa. And thank you for taking all of us along, 51 of us on this call. Yeah, very interesting conversation we've been having. And when it comes to the matter of youth advocacy, something that, I mean, not just me, a lot of young people are very passionate about. But I like to say that even for me, FGM advocacy is something that is very personal. I'm a survivor of FGM, but I'm glad that I'm not just a survivor, sharing my story and then not doing anything about it. I'm glad that I'm also using my story to create meaningful change in the community. And I think that is the essence of the conversation that we are having. That survivors are not just stories, for the books, but they are actually at the center of advocacy and leading change. And that even creates more power and sustainable change at community level. That being said, yes, my work started as a medical student who happened to be schooling in a state with the highest prevalence of female genital mutilation. That's in Nigeria. And somehow we were taught about FGM, and just my curious self wanted to do something about it. It continued like that till I got to the point that I am now. I remember starting Value Female Network as a year four medical student. And one day I was on air, I was speaking on FGM, and then somebody called in to say, oh, you students that don't have jobs, when you're done with school, you will know what, life really holds. I'm sure you will be out of all of these fantasies and forget about all these things that are our culture that you're trying to castigate. Is because you're still in school and you don't really know what you want out of life. I mean, that was a challenge for me. And I'm like, no, this is beyond, just being in school and not okay. So I attended the public school in Nigeria. So most times we were in and out of strikes. If you've heard that several times, I remember we were on strike for like almost 8 months. And so the person had a valid point because it was during one of those strike periods that I was on here. I'm not sure. I think my network is unstable, but can you hear me?
Yes, we can, Dr. Cosley.
Okay. Okay, thank you. So the person had a valid point, but of course we are where we are now, and we are grateful that I'm not just doing this work alone. A lot of survivors in Nigeria are lending their voice, but not just in Nigeria, beyond Nigeria, across West Africa, East Africa, different African regions, all around the world. More young people are joining the movement, more young people are speaking out, and I'm still here also speaking out. It's something that when I reflect on, I'm grateful to God that also I'm able to prevent my own daughter also from being mutilated from FGM. That being said, I think I should stop on that, just reflecting on my journey. I don't want to take too much time. Thank you, and over to you, Anna.
Thank you so much, Dr. Cosley. I don't think we all have had enough of your experience, but I will give you another opportunity in the second round. Thank you so much for showing us how we could actually make a difference and how making actual change is what matters, and making sure that sustainability is at the core. And Dr. Cosley, I have seen that you are an example of what breaking barriers looks like. You're an example of what breaking the stereotype looks like. You're a professional, you're a youth advocate, you're giving back to your local and global community. So thank you so much, Dr. Cosley. Now we are going to take another flight to East Africa, and we are going to meet with our third speaker, who is Mohammed Yasser. Yasser is the co-founder of Silver Lining Kenya organization, SLKO, in Garsi County, Kenya, where he leads community programs amplifying the voices of marginalized groups, especially women and young girls. He is a Yali alumnus. He is committed to advancing human rights and empowering women as key drivers of positive social change. So, Mohammed, please tell us about your own advocacy journey on ending FGM and also about your organization. The floor is yours.
And thank you, Hannah. Thank you for having me. And thank you also, Kirigo. Thank you for having us. And this is Yasir Mohammed. And I remember we started our organization back in 2016. It was an organization that had a group of students that, came together for a common goal. And we started as a volunteer organization deep from the grassroots. And we started with mentoring young girls, and we started by going to schools and talking to our young girls on the effects and the harmful effects of FGM, and not only physical, but also the mental side of it. And those are the things we talked about. And one of the things, can you hear me?
Yasser, we lost you for like
Hello?
a minute.
Sorry, I'm in a very remote area. I'm back. I guess I'm back now.
No worries, no worries. Yeah, we can hear you now.
Hello?
Please go ahead.
Can you hear me?
Yes,
now?
yes, we can.
Yeah, so we started this organization back in 2016 as a group of students. So So what we did was going to schools and mentoring young girls on the effects of FGM. And what we also looked at was not only the physical part of it, but also the mental side to it. And those are the things we also focused on. And recently, I was working with my organization. We were working closely with the county government of Garissa in regards to working towards a policy towards ending FGM. And we were working with the religious leaders, with the community members, and also with the relevant stakeholders, where we brought them together and drafted a policy to end FGM in Garissa County. So we have been working on it for the past maybe 2 years, and as you know that it is a very tough thing doing when you are working on policy, and it has a lot of burnout and a lot of work that comes with it. And we were working closely with the leaders, and we are still working with them. And hopefully, we will come to the bill will be passed, and that's something we are looking forward to as not only as an organization but also a community in general. And we are working also with the youth and in terms of FGM, and we have come with a unique way of doing it. For example, we are doing it in a way that it's more involving for the youth, and with regards to art and using art in the end of FGM. So using art, in ending FGM, that will make the youth become more engaged in these spaces. Yeah, thank you, Hannah.
Thank you so much, Esther. Thank you for taking the time to share your experiences despite the connectivity issues you are facing in a remote area. So Yasser has shown us through his 9 years journey with his organization that he co-founded with his fellows that grassroots work really matters, that we have to start from the bottom. We really have to address issues on a community level and then go from there. And thank you so much for sharing us that using a different approach to create meaningful youth engagement is very important. One shoe size fits all. It doesn't work like that. And thank you again for stating that issue. Now that we have had a good stay at East Africa, we are again taking a flight back to West Africa, and we are meeting our next speaker, Kadiatu. I hope I am pronouncing your name correctly. I've been practicing. We are going to meet Kadiatu from Senegal. Kadiatu is a master's student in law and international relations at Sheikh Anta Diop University in Dakar and a human rights activist advocating for women's and children's rights. She works as programming and volunteering assistant at Social Change Factory and is active in several networks fighting for FGM, winner of the Rainy Kassin Human Rights Prize in 2019. She is also an alumna of leadership programs with the Frederick Ebert Foundation, Yali Dakar, and the Center for Mediterranean and International Studies, and a member of Plan International's Global Influencers Group. Kadiatu, we have seen you have such an amazing profile, and we will be listening to your journey.
Oui, merci beaucoup.
Kadiatu.
Est-ce que vous me recevez bien, Monsieur Mohamed, pour la traduction? Ok, 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 merci. Dites-leur par rapport aux caméras, je m'excuse, je ne pourrais pas allumer ma caméra. Est-ce que je peux y aller? Ok, très bien. Alors, merci beaucoup. Bonjour à tout le monde. Moi, je m'appelle Hadika Toukebate et merci à Anna pour la belle présentation qu'elle m'a faite. Merci également à toute l'équipe d'Orchid Project pour cette invitation et pour l'organisation de ce webinaire. Alors, comme l'a dit Anna, moi, je suis juriste de formation au niveau du Sénégal et je m'active beaucoup sur les questions de mutilation génitale féminine avec une expérience de presque 12 ans au niveau du Sénégal et particulièrement dans ma région Tambacounda, qui est une région où il y a beaucoup de mutilation génitale féminine d'après les dernières statistiques de l'ONU Femmes et de l'UNFPA. Alors moi, je vais vous parler d'un élément important qui est important dans le plaidoyer, qui est la mobilisation des communautés. On a même parlé de mon expérience au niveau de la boîte à outils, c'est-à-dire qu'aujourd'hui, on parlait tout à l'heure des messages qui sont très importants dans le cadre du plaidoyer. Et en cela, les communautés ou bien la mobilisation des communautés est quelque chose de très important. Vous pourriez prendre l'exemple aujourd'hui d'un comité de financement avec l'ALM, l'Africa Led Movement, qui finance aujourd'hui des organisations qui s'activent dans la lutte contre les MGF. Alors, dans ce cadre-là, il y a plusieurs membres de la communauté qui nous pensons que si elles se prononcent sur les questions de MGF, on pourrait bannir cela au niveau des communautés. C'est le cas des religieux. Parce que beaucoup de personnes qui pratiquent les MGF, ils le tirent ou bien disent que c'est religieux parce que c'est Dieu qui l'a autorisé, etc. Alors que peut-être que tel n'est pas le cas. Donc, il est important d'avoir ces éléments importants de la société afin de pouvoir lutter contre ce phénomène-là qui est les MGF. Un autre élément important dans la mobilisation des communautés, c'est aujourd'hui les gouvernants. Pourquoi les gouvernants sont importants ou bien le gouvernement en tant que tel? Par exemple, dans mon expérience que j'ai eue lors du Forum Génération Égalité, où j'ai eu à représenter la jeunesse sénégalaise, il y a eu aujourd'hui une sorte de pré-forum qui a été organisé au Sénégal. Et lors de ce pré-forum-là, il y a eu pas mal aujourd'hui de composantes du gouvernement qui étaient notamment des ministres, avec le ministre qui s'occupe du genre au niveau du Sénégal, et avec la direction de l'équité et de l'égalité des genres. Excusez, nous avons eu à développer ce qu'on appelle des coalitions d'action pour dire que voilà ce que nous, jeunes, nous proposons au gouvernement dans le cadre de la lutte contre les violences basées sur le genre, d'une manière générale et spécifiquement dans la lutte contre les MGF. Donc ça, c'est vraiment des aspects très importants qu'il faut mettre sur la table. L'autre élément aussi, c'est l'aspect juridique. Tout à l'heure, Anna a fait une très belle présentation de moi en disant que je suis étudiante en droit. Effectivement, je suis juriste et je pense que l'aspect juridique aussi, il faut le mettre sur la table. Pourquoi il faut le mettre sur la table? Parce que, par exemple, au Sénégal, les MGF, c'est une pratique qui a été criminalisée depuis 1999. Et puisqu'elle a été criminalisée, cette pratique-là, il serait important qu'on puisse appliquer en tant que tel le droit. Malheureusement, on peut compter que quelques cas sur lesquels on a
Unfortunately,
à
there
juger
are
les personnes
some
qui ont pratiqué
cases that
cette
are sent to the
mutilation
court.
génitale
This
féminine.
is
Donc,
really a
en ce sens, il
problem
est
in
vraiment
our
important de
country.
mobiliser les
So that's
communautés,
why it
que
is
ce soit les leaders
important to
religieux et
mobilize
communautaires, que
communities
ce soit
like
le
religious
gouvernement,
leaders,
que ce
community
soit
leaders,
les
the
jeunes
government.
activistes et aussi
Okay,
les partenaires
even
techniques et
young
financiers comme
activists,
aujourd'hui
even
le
okay,
projet
some
Action
technical partners
et
and
l'ensemble de
financial
leurs
partners
partenaires
also,
qui luttent
and
contre les
all the
MGF parce que c'est
components
eux
that are
qui peuvent
fighting
accompagner
against
davantage
FGM.
les jeunes
So
dans
those
leur lutte et
coalitions
qui
of
aussi
network
puissent
can
les
be
supporter.
helpful,
Donc, c'était
to
ça en
make
tant
the
que tel.
government apply the
Et
law.
tout en vous
So that's
remerciant pour
what I would like
l'organisation de ce
to
webinaire.
share with
Et
you.
je reste à l'écoute s'il y
I'm
a des
very
questions pour apporter davantage
open. Okay, I
d'éléments
would
de
like
précision.
to
Merci.
bring more highlights. Thank you so much.
Okay, thank you so much, Kadiatu. I hope everyone was able to turn on their interpretation. It was such an amazing presentation. Congratulations, Kadiatu, on the amazing work you have done. Actually, you have also kind of addressed my second question, and it was really lovely to hear what mobilization strategy you used, how you engaged the government, how you engaged the policymakers, how you engaged the Ministry of Women, the Ministry of Justice, the Ministry of Equity and Gender. So this is really amazing, being able to take part in those discussions with these decision makers is great progress. So I think our last speaker, last but not least, is Loveness. I'm so happy to see that we still have Loveness in the room. So Loveness is a program associate consultant at Rosaria Memorial Trust and founder of Passionate Circles, a survivor-led initiative supporting girls' education and empowerment. She was a lead applicant in the landmark Mudzuru Ministry of Justice case that outlawed child marriage in Zimbabwe and continues to champion survivor-led advocacy and inclusive approach to ending gender-based violence. So, Loveness, please take the floor and share us your journey. Oh, I'm sorry. I think Loveness would be speaking on the next, that she would love to respond on the chat. So this is to everyone. In case you have any comments and questions on what we have discussed so far, please feel free to put it on the chat box. So far, Kirigo and the team has been sharing different materials, the toolkit, the Kigali Declaration, the use call to action, a few documents and materials are being constantly shared. So you can refer, but at the same time, please feel free to drop any questions, any comments. You are more than welcome. Saying that, I would be proceeding to our next round of questions. I think I should proceed to the next round of questions, right, Kirigo?
Yes, and we have not very much time, so let us keep it as succinct as possible. Thank you, Hannah.
Thank you so much, Kirigo. Time is running against us, so we will be speaking more shortly. So in the next question, I'm going to give you 2 minutes each. And the question is again the same to everyone, simple yet very powerful. So as we have seen from Kirigo's and Katie's presentation, that the Advocacy Toolkit outlines 5 different tactics. This is meant for powerful youth advocacy. So each of our panelists will reflect on which tactic has been the most useful in their work. So it's going to be a personalized experience. Again, all of you will have 2 minutes. So please let's stick to our time. I think I will go to Sri Lanka and we're going to meet with Nabila again. Nabila, please share us your choice of tactic and how your journey has been with the specific tactic.
Hey, Hannah, thank you so much. So I've chosen tactic number 5, that's to engage with regional and global policy events. It's really important because a lot of the time FGM happens locally, but we forget, not that we forget, but we can also notice that there are similarities and connections and how it happened, the trends in how it happens across the globe. And when we initially started, we noticed that there was already a lot of advocacy done in the past about bringing FGMC into the light. For example, calling it as a cruelty against children and bringing it up at Child Rights Convention reporting sessions. But afterwards, I think the momentum kind of stopped because there was a lack of data on how prevalent FGM was in the country. So when the researchers from Women's Action Network, I think some of them were on the call earlier, when they started this research and they concluded it, we were able to quickly find out some key highlights from that research and summarize that just in time for the CEDAW review of Sri Lanka, which happened early in February this year. It was such a fast wrap up of data and concluding and coming up with briefs to really lobby committee members in the CEDAW committee on these issues. And we were also thinking a lot about how do we frame these problems? Do we bring it up as a women's rights issue, a child's rights issue? And that's when we decided, okay, we'll make it a public health issue, so that this is a issue we want against anybody. We don't want anybody to face this problem, not just Muslim women, not just women, not just baby girls. Because in the Sri Lankan context, this was happening to girls at the age of 7 days, 14 days, and sometimes 7 years. And women who have converted to Islam, so they are much older in age as well. So that's why we wanted this public health kind of framing. And interestingly, when we brought this up, the government also, because they have to respond to these problems, they were not sure how to respond because they had also not done collected data in on the Sri Lankan population on this issue. It was so bad because even our SDGs, our Millennium Development Goals, on FGM, they don't have any data. That's why it's not reported. And just because they have banned it in public hospitals, they just report it as it doesn't happen anymore. And they word to word said that we don't have any complainants coming forward and saying that this was done to them. We don't have any victims on record, so this is not happening in Sri Lanka. So it was the first time they were also hearing the research, even though we had tried to lobby them previously as well. So there is an interest on the end of the government now to make sure that they can do something about it. But it's important because the, even a government official would not want to touch something if they sound or look racist. Because this is done by a minority community, which is why we said, no, this is a public health issue. We are not trying to protect women or anything like that. We're trying to eradicate an issue against children, a cruelty against children. So that kind of framing was really important to get that ball rolling and to get everybody interested in it. And then later on, we made sure when we released the final study and the research that there is some highlight given to it because it's local knowledge and there's a lot of local language used in it, and it's not just like WHO type 1, type 2, type 3 that we're calling it. We're calling it like in the local words, in the local language, what these things mean, and explaining how harmful it is. And because it was a public health issue, we also wanted to address it with religion. So that we had pamphlets written and done by a religious scholar so that we could share it with public health officials so that they don't feel stressed to explain it to people of a minority community. So that was also really important. So apart from this, it's really also important to be able to articulate FGM issues in the overall human rights space. For example, the UN has lots of mechanisms like special procedures, or they will call for recommendations from different Office of Human Rights officers or agencies. So in those topics also, it's very important for us to articulate FGM as a human rights issue. So for example, when the OHCHR, that's the Office for the Commission on Human Rights, they were requesting recommendations on how we can protect minority communities. So even then, you had to articulate FGM is also a threat to minority communities because it harms women in these minority communities. So to be able to frame those issues and articulate those issues, also it's important to make sure the conversation keeps going. So I'll just end with that and just wrap by saying local knowledge, local data, and those studies are vital because without that, it's difficult to do anything in the global stage. And it's only those things that you have to amplify and make sure we are protecting researchers' anonymity and identities and things like that. But at the same time, if you don't highlight these issues internationally, then governments also don't have any sense of accountability to make sure that there's some kind of protection for women and girls. Thank you.
Thank you so much, Nabila. You have given us such a very insightful experience on the importance of proper framing and the importance of indigenous languages, using indigenous knowledge, and reframing our issues as something that the policymakers and both the community can accept. Thank you so much. I hope everyone else is enjoying. If you have a question, make sure to address it in the chat box again. Saying that, I think think I will go to Dr. Cosley. Dr. Cosley, maybe you have something to add on this tactic. The floor is yours.
Thank you, Hannah, and such a very great, insightful words from Nabila. I like the perspective she has spoken from. I'm just going to add a little more perspective, especially from what a lot of young people can relate to. So we get selected for lots of opportunities to attend meetings, to attend conferences, to speak at events, to attend events, to be part of conversations. I just want to say to young people that in as much as we go to all of the spaces, let us let us not forget the main reason why we're going. A lot of young people get opportunities, and the only thing they remember is that, oh my God, I'm visiting the next city, I'm ticking off my bucket list, I'm doing all of this. But in as much as we want to do that, let us also learn that what the main reason why we've been selected to go is because there's something we'll have to put on the table. And the truth is that when we get to that table and we're able to contribute meaningfully, we also open up spaces for other young people to be part of conversations. So you don't let it end with you. You open up even more spaces for young people. I'm going to cite an example with the African Union International Conference on Female Genital Mutilation. It was planned. There were so many people on the planning committee, youth voices were part of it somehow, but we found out that this is what is happening. And as a group of young people, as a movement, we leveraged that opportunity. We started by planning way before long before the conference. We took time to identify key side events that we wanted to organize as young people. Not only that, we were able to bring all of these side events to limelight. We even organized a youth side event where we had a lot of young people speak. We also ensured that the voices of young people were mainstream into each of the panel, each of the sessions, different plenary sessions, different side events. We ensured that we had young people. And at the end of the entire conference, what was not planned before, we had a youth toll, which is like a youth manifesto, which we've been tracking since then. I mean, in as much as we wanted to go to Tanzania, oh my God, they have very beautiful, the city is beautiful. They have nice tourist centers. We also were very sure or certain of what we wanted to achieve at our conference. So yes, I understand that we want to take nice pictures, we want to post online, we want to jump on the next flight. But please, as young people, let us understand that the main reason why we've been selected to go for different regional events is to ensure that we are able to bring the perspective of young people on board. But beyond that, even at the event, we are also able to identify key partners, key allies. I mean, these regional events are places where you strengthen, allies, you build meaningful allies. This is where commitments are being made. Funds are being given, different commitments, and this is where you can actually key into some of the things that are happening. So do not lose sight of that when you're going for this meeting. Preparation is very important. With the AU conference, we prepared ahead. When you get there, you act. I mean, if I'm going to give like a tactics in tactics, I would say prepare. When you get the hacked, of course, connect, because that is where things really happen. In as much as FGM happens locally, but regional events, regional conversations are where things really shift positively as well, as much as it does in the community. And I want to tell you that whether you are engaging as a young person on this call, whether you're engaging at regional level, global level with the UN, or national or local level, every of these spaces are very important. In fact, it's even more hard at the local level because people know you, they know your daddy, they know your mommy. They can report you, they can silence you, but still you refuse to be silenced. So your voice is also very important, even at local level, state level, province, and all of the spaces where we find ourselves. I mean, conversations like this, attending regional events have opened up spaces for even more youth funding, youth commitment. And so as young people, we should learn to maximize and be part of strategic decision. One of it is the AU Convention on the Elimination of Violence Against Women and Girls. I like the way young people also engage in this in this document all through the process of from the draft to the review. And now we are at the point that we are asking member states to start to ratify or domesticate this convention. This is also an opportunity for young people to jump on, especially young people in Africa and in other continents as well. We can identify key key documents that as young people we can also engage. Thank you very much. I mean, I've said so many things in a very short time. Thank you, and over to you.
Thank you so much, Dr. Costley. This is not just a speech, this is an assignment for all of us. Please let's take this to our hearts as we are taking spaces. Let's make sure that we are making the best of it and not just taking a space. So as you can see, we are really running out of time. So unfortunately, for our next speaker, I'm only gonna give you 1 minute. Please stick to this 1 minute. Yasser, this assignment is for you. Share us your experience in just 1 minute. Thank you. Over to you, Yasser.
And thank you, Hannah. Should I speak on tactic number 4 or maybe?
Yes, please do. Please do. Tactic number 4.
Okay. Thank you. And on supporting positive mental health and well-being across the movement. Thank you, Hannah, again. Thank you for the opportunity. And for me, supporting positive mental health and well-being has been, one of the most important parts of advocacy. And working on FGM is at times, deeply emotional and, sometimes very heavy for the heart. And many are survivors, many who are here are survivors of FGM. And others are, like me, are hearing, constant painful stories, and narrations coming from the survivors. And, without spaces to care for our well-being, the burnout and the exhaustion that comes with it can, quickly take over and things can be, very, very bad. And in my work, I've seen that when we create safe spaces where youth advocates can share openly and encourage one another and also access psychosocial support, the whole movement grows together, and the unity of purpose becomes strong. And it's not just about surviving the work, it's about thriving in it. And small things like peer check-ins, mentorship, and even integrating moments of joy and creativity into our advocacy can also make a huge difference for many of us here. And supporting mental health is not, it's not a side activity, and it's essential to sustaining the movement. And at times we talk about the physical,
Sorry.
you
Yes, sir. Sorry to interrupt. Please conclude it in one statement so we can hear from Kadiatou.
I'm concluding. Thank you. So, and if we take care of our well-being, we stay resilient, we become motivated, and be able to support the girls and also the communities we serve. So thank you very much, Hannah. Thank you.
Thank you very much, Yasser. That was amazing. Next, we will be going to Kadiatou. Everyone, make sure to turn on your interpretations. Kadiatou, the floor is yours. Please stick to the 1 minute we have left.
Ok, super, merci beaucoup. Alors, moi, la stratégie que j'aurais à proposer est, selon moi, qui serait importante à mettre en place, c'est vraiment aujourd'hui de puiser sur les communautés, c'est-à-dire s'appuyer sur les communautés et que les communautés soient les forces, les acteurs de la lutte contre les mutilations génitales féminines et la lutte contre les violences basées sur le genre d'une manière générale. Pourquoi les communautés? Parce que c'est dans les communautés que se pratiquent les MGF et ce sont ces principales communautés-là qui devraient quand même être aujourd'hui les acteurs de la lutte contre les MGF. Parce que c'est les communautés qui vont te dire que nous allons pratiquer aujourd'hui les MGF. Il faudrait retourner chez ces communautés-là pour essayer de voir avec eux comment est-ce que nous allons être une sorte de grand mouvement pour lutter contre les MGF. Nous voyons déjà que cela existe aujourd'hui au Sénégal, au Kenya, au Zimbabwe, en Guinée, partout dans le monde. Nous voyons aujourd'hui ces mouvements-là que portent en réalité les communautés. Mais c'est peu, c'est pas suffisant parce qu'il y a toujours ce qu'on appelle les anti-droits. Et ces anti-droits-là, il faudrait quand même essayer de les convaincre, essayer de les montrer avec des exemples patents que ces mutilations génitales féminines-là nuisent à la santé des jeunes filles, à la santé des jeunes femmes. Et c'est pas seulement ces antidroits, c'est pas seulement les hommes, c'est aussi les femmes. Parce qu'il y a des femmes qui te disent carrément que, ici au Sénégal, par exemple, si une femme n'est pas excisée, elle n'est pas bonne à marier. Et c'est vraiment des pratiques et stéréotypes qu'il faudrait vraiment poser sur la table et lutter. Donc, pour moi, c'est vraiment une stratégie à mettre en place et à utiliser, c'est-à-dire s'appuyer sur les communautés. Merci beaucoup encore une fois et à la prochaine.
Thank you so much, Kariatu. That was really amazing. In order to save time, I have shared you my journey with my most used tactic. I have put it in the chat box, and I'm sure that every one of you has seen what Loveness has been sharing for us, her journey, her advocacy like works, her experiences, what she did. So even if it's very short, I hope you can get a glimpse of what has been going on in the bigger aspect. So now that we are running out of time, we will just see the chat box if we have any questions from our participants. I haven't seen any questions in the chat box. Did I miss anything? Here you go.
No, you didn't. I haven't seen any questions, but I know Hani from Somaliland had asked if she could share. So Hani, if you're still around, Ismail, please unmute yourself and share with us what you wanted to share. And if anyone else has a question or a comment, please feel free to raise your hand as we close out. And also for the panelists, please feel free to put like your final thoughts, your final words on sort of the future, let's put it that way, of youth advocacy and what your hopes and aspirations are. And everyone else, actually, all the young people that are here, what your aspirations and your hopes are for youth advocacy. And yes, we are 5 minutes over time, and thank you so much for everyone that stayed with us. I had a really lengthy 3-minute closing remarks speech, which I will not go into, but to say a really, really big thank you to all our panelists, keynote speaker Loveness, who has been with us for a longer time than I expected because she was due to handle other business, to the back end team that has put this together. It's been quite a bit of work. So thank you so much, everyone. And I think my parting shot for everyone, I've shared the toolkit. Again, if you want to connect with any of the panelists, please let us know. And my parting shot will really be to say what the toolkit says at the front of it, which is act now and be part of the change. Youth lead the way to a better future. So thank you so much for all the work that you're doing. And all the work that you will continue to do. And part of the work that you will continue to do, especially for those people that are part of the East Africa region, is join the Global Youth Consortium and the Anti-FGM Network Kenya, Youth Network Kenya, that are hosting a webinar on Friday to speak specifically about the East Africa FGM bill, which is being debated at the moment. If you want to be part of that, please drop your email on the chat, and I will ensure that the team that is leading this, was Mercy and Valerie, who are also on this call, will be in touch with you to join them. So a really, really big thank you from the Orchid and the Girl Generation team for joining us. And good afternoon, good evening, wherever you are, and have a great day, night, morning, and hopefully we continue to connect. I know that the GYC team will want to take this further in terms of really deconstructing the toolkit, and we will share when that is due to happen. So thank you very much for joining us. Last words, Hannah, as our moderator.
Thank you so much, Kirigo. Thank you, everyone. You've been such an amazing audience. We would love to hear from you. So this is not the end. I just want to say that this conversation is just starting. Make sure to keep in touch with us. We would love to discuss on the advocacy toolkit with you. I'm sure we will have so many more interesting stories to share from all across Africa. So let's please stay in touch. As you can see, Kirigo has shared some of the materials here on the chat box. If you need anything more, we're always available. Let's fight FGM. This is a collective movement. Thank you so much. Enjoy the rest of your day, your night, your evening, your morning.
Yes, thank you, everyone. I have popped in my email in case you need to get in touch, and so has Katie. So please, anyone else, put your email in there, and let's keep the conversations going. Thank you, everyone.